Hi, I'm going to be talking about left-sided heart failure. So in this case, my patient has left-sided heart failure and he's wondering why he has a bunch of respiratory problems. So I'm going to explain to you basically how left-sided heart failure works. So it's caused by excessive drinking, an MI or a recent MI, so there's damage to the heart tissue, heart infection, hypertension or hypothyroidism, many more, but those are the most common. So he's gonna have symptoms such as a cough, like a chronic cough, and if you auscultate, you're gonna hear crackles, and you might see cyanosis, signs of cyanosis on his nose, fingers, lips, toes, hands, and he's gonna have orthnopia, which is when he lays down at night or when he lays down at any time, he's gonna have a lot of difficulty breathing, and that's because of all the he has a lot of pulmonary edema. So when he lays down, that pressure is gonna really crush down on his lungs, and it's gonna make it really hard for him to breathe. He's gonna have shortness of breath. And he's going to have fatigue, he's going to have weakness, and that's again because, I'll explain it a little bit later, but it's basically because the heart is not giving out oxygenated rich blood well enough to the rest of the body, so the muscles are deprived of oxygen-rich blood, therefore it causes fatigue and weakness and stuff. So he's going to have an irregular heart rate, shortness of breath, and he may even wake up in the middle of the night because he's so out of breath. Weight gain due to the edema and the fluid retention, hypotension, and a really low stroke volume. So how left-sided heart failure works is, this is just a little quick lesson on how the heart works. So on the right side here, on the blue, is the deoxygenated blood. So we get deoxygenated blood from the body here in the right atrium, goes down to the right ventricle and pumps it out to the lungs. Now the lungs, in the lungs it gets oxygenated, comes back from the lungs to the left atrium, down to the left ventricle, and out to the body, delivering oxygen-rich blood to the rest of the body. That's how it's supposed to work. But in left-sided heart failure, what's going to happen is this right here is the problem from the lungs. So the oxygen-rich blood from the lungs here, the left side, is where the problem is. So either the heart's not pumping right on the left side, or it's got atrial fibrillation or something like that, and so the blood can't fully be taken in by the left atrium at its full potential and then exited out, so it only takes a fraction of what it's given. So you can imagine that it backs up into the lungs. It creates a backflow almost, backup. So then all this fluid and all this blood gets stuck at the lungs because the left side of the left atrium can't take it all in. And then, to add to that, for the edema, now it's going to go down to here, not as well as it's supposed to, and then go out to the body, not as well as it's supposed to again. So then the oxygen-rich blood is not going to get into all the tissues. So that's pretty much why he's getting all these respiratory symptoms. It's because, again, it's getting backed up into the lungs because the left atrium is not able to take it all in and then pump it out adequately. So it's just kind of staying there, and that's why there's much more fluid around the lungs, and that's not good. It can get into the alveoli and stuff like that, so that's why he's getting all those symptoms. So good luck, dude.